The House Ways and Means Committee has completely rejected Governor Shumlin's ill-conceived proposal to tax independent physicians and dentists at a rate of 2.35% of their net patient revenue. Dr. Jim Hebert, VMS President, wrote a terrific op-ed criticizing the proposal, and independent physicians Dr. Toby Sapkin and Helen Rabin also testified with me before the House Ways and Means Committee. The point was made what a deleterious impact this would have on patient access and the difficulty it would be to attract and retain physicians in Vermont. All thanks to the legislature for seeing the wisdom of rejecting this ill-conceived proposal.
The Senate Finance and Appropriations Committees are finishing their work on the fees and appropriations in the opioid prescribing bill before it moves to the Senate floor. But the good news for VMS is the Senate Health and Welfare Committee amended the bill significantly in response to testimony from physicians on the VMS Opioid Task Force. Instead of mandating physicians to check the VPMS every time they prescribe an opioid or every time they prescribe a refill, the bill now requires the Commissioner of Health to adopt rules with a robust process for input from physicians and other professionals about what requirements should be added to the current requirements, if any, to check the VPMS. The 10-pill limit, the notorious 10-pill limit, has also been replaced by rulemaking. The rules may, but are not required to include numeric and temporal limits on the number of pills prescribed. VMS and the Opioid Task Force really appreciate the work of the Senate Health and Welfare Committee and look forward to working with the Commissioner of Health and other practitioners on the rules. H690, which has now passed the House, creates a license exemption for Vermont physicians with appropriate training who provide medical acupuncture treatments as part of their medical practices. Currently, without an exemption in the acupuncture law, a separate acupuncture license is required in addition to the medical license. Other professions in Vermont that have overlapping scopes of practice, such as dentistry, psychology, physical therapy, chiropractic, etc., include exemptions for physicians that allow them to incorporate aspects of these professions in their practices under their medical licenses. About 35 other states have acupuncture exemptions for physicians who provide acupuncture treatments, and the bill will now move to the Senate.
The Vermont Medical Society continues to watch S-241, which is the bill that would legalize marijuana. As most of you probably have heard, it passed the Senate a few weeks ago by a vote of 17 to 12, and it's now being taken up in House Judiciary, and we'll be providing testimony along with some of our other partners. So we'll be following that, and we'll keep you updated. H171, a bill that would regulate e-cigarettes to be restricted in places where lighted tobacco products are also restricted, passed the House last week. And also during that floor debate, there was an amendment put forward by Representative George Till, who is a OBGYN, and the amendment was to increase the legal age to purchase tobacco products to 21. After some debate, there was a vote, and the vote actually came out tied, and which ultimately killed the amendment. So the bill passed without the amendment, but there is a new push to get that legalization increase going this year. So we'll be watching that as well.